Yeah, greetings to everyone, especially to our social welfare officers who have the opportunity to watch this video of mine. I'm David Nabwari. I'm a mental health practitioner working with Ghana Health Service, and I also operate an NGO in the Nkwanta South. Yes, me speaking here, I have had the opportunity to be an assemblyman elected in the Nkwanta South for 4 years, and working closely with the assembly, I had the opportunity to chair the social services subcommittee where I work closely with the social welfare department. And in some cases, during those days or those times, I happen to get first-hand information on some cases that are being brought there in terms of resolving them and getting issues done. So the pressure on our social welfare officers in Ghana needs attention. And also, not only that, our social welfare officers actually need this very training I'm looking at piloting in some districts and regions, psychosocial support training, because almost every case that you receive have some form of mental health and psychosocial support component that you have to look at. And as a social welfare officer or director, you have to have this knowledge so that you'll be able to provide uh, some form of mental health and psychosocial support for persons who visit your department or unit. Yes, this also brings me to calling on all presiding members, calling on all municipal and district chief executives and the Ministry of Local Government to prioritize issues on mental health and psychosocial support, and also to also look at how we can collaborate and train most of our social welfare officers. I know some have had some training when it comes to mental health and psychosocial support, but we are looking at this from a mental health background perspective. So, as a mental health practitioner who has been conducting trainings in these areas, I think I am open for that engagement, and I want to engage social welfare officers. We want to see what is actually the mental health and the psychosocial issues that you actually encounter in your various unit department. Fortunately, most of the social welfare officers have also been attached to some hospitals so that they will be able to provide that social support that our members that need them will be able to have access to them. But some have no practitioner there. So my social welfare officers in all the 261 MMDAs, my calling this point and at this very moment is that we need to work together. And I know the collaboration that exists between the social welfare department and mental health units or the mental practitioners out there. So all that I want is that can we get it at a point to a point that we sit down to look at how best we can have you have this training when it comes to mental health and psychosocial support. Yes, so when we talk about mental health and psychosocial support, I know that as you receive the issues, most of them may have mental health challenges, and most of them may need psychosocial support, which you actually have some first-hand information, but to be able to provide those services and also help members enjoy from what you know, that is what we are looking at. How do we bridge the gap that you have that technical know-how to provide some form of immediate mental health and psychosocial support for your members or for the community members who come to your units for help. Yes, we know very well that when it comes to persons with disabilities and so on and so forth, almost all of them may have some mental health challenges. Even not those with disabilities, those without disabilities, but maybe facing issues that social welfare needs to intervene, may have challenges. So how do you integrate mental health and psychosocial support to some of your services you provide, or to all the services you provide for community members at your department? Yes, so integration of mental health and psychosocial support services into social welfare services that are provided in our Ghanaian setting and also in our various places of work. And you yourself, you need to also have that work balance. We know the workload on you. From time to time, you need to have training on mental health and be able to keep yourself mentally healthy before you even look at the mental health of some other people. So together, I am ready for us to look at this training and be able to get most of you trained. Yes, if you want to contact me one-on-one basis, you can reach me out on 054 and let's talk. Yes, let's look at how we can work together. My social welfare officers and social welfare directors, the regional coordinating councils, the municipal and district assemblies, and the national Ministry of Local Government and Rural Development. Yes, we want to work together. Yes, the NALAC, National Association of Local Government Authorities. Yes, the Dean of presiding members. Yes, we appreciate the work you're doing, and together we can all support our social welfare officers, and let's champion the work of social welfare. Thank you.